At TriStar Hendersonville Medical Center, the televisions are bigger and smarter than ever before and are changing patient experience for the better.
It really started off as a patient satisfier, just to be able to airplay their own content from their own device onto a larger screen.
TV as a platform was developed by Aaron Montlery and a team of IT specialists. They were looking for a way to use the TVs in patient rooms, not only for entertainment, but as a central point of communication for the care team and patient. While patients can now use Netflix and other streaming services, nurses and doctors are using it for clinical purposes too.
When physicians found out it was there and they realized that they could go into the room and project clinical images on a larger screen and use that as a teaching tool for patients to be able to share an MRI scan with them that probably the patient wouldn't have seen otherwise.
In addition to being able to use the TV in each patient's hospital room like they would at home, the new platform has an L-bar that has improved workflow for nurses and physicians.
There's a band across the bottom and up the right-hand side of the TV that has the doctor's name, the nurse's name. Information is pulled from our medical record regarding the caregivers, about the patient's goals for the day, about the last time a pain medication was given.
We'd see a lot of opportunity for these TVs in the future. Video translation services bridge the gap between the language barrier and be able to do translation. The opportunity to do intelligent routing on the TVs so patients can order their own non-clinical items through the television screen. And what that does is it gives our nurses back valuable minutes in their day.
It really does set the stage for a lot of what's to come technology-wise. And we really think it's a core of what the new patient experience can be.
For creating a platform to improve patient experience and communication between caregivers and patients, Aaron Montlery is this year's HCA Innovators Award recipient in the category of Service Excellence.
This is one product of many to come that will better the lives of our patients and make the workflow of our clinicians even better.
It started as a way to better diagnose nutritional needs for patients at Skyline Medical Center. Clinical dietitian Donna Harrell and her team used an evidence-based screening tool to identify a patient's nutritional risk.
A third of patients admitted to the hospital are malnourished. Getting that intervention for them, treating that malnutrition, they have better outcomes. They have reduced length of stay, they have decreased the chance of infection or pressure ulcers. They heal better because of that nutrition.
Physicians asked for better communication. Was there a way to put that information automatically into the patient's medical records?
The main key was getting that information to the physicians that, yes, this patient has malnutrition. They need a nutrition diagnosis. They need interventions to treat that malnutrition so they can have better outcomes.
A division-wide team was created, and Donna collaborated with coworkers from Skyline and Health Trust, using existing technology and resources to create the Food and Nutrition Malnutrition Initiative.
She identified this problem and came up with a way to be able to put the data in front of physicians so that then they could act on it along with the dietitian.
Proper nourishment is key and essential to healing. Malnutrition is something that is experienced by many patients that come to our building. I saw an opportunity to improve patient care and saw an opportunity to manage communication.
The innovation is now being used throughout the TriStar division with plans to expand.
We are very proud that Donna and Health Trust are shaping a clinical solution that has the opportunity to have a profound impact on patient outcomes. We couldn't be more excited about the opportunity to scale this best practice across the company.
For her dedication to patient care and malnutrition, Donna Harrell is this year's recipient of the HCA Innovators Award in the category of Quality and Patient Safety.
I want to say thank you. The awareness of malnutrition, having that out there, and the recognition for the dietitians is so important.
At Southern Hills Hospital and Medical Center in Las Vegas, every time an employee swipes their card and clocks in for work, data is recorded to ensure that patients' needs are met. The problem? That information used to go to 3 different data sources.
In our research, we found that on average, leaders were using up to an hour of time to figure out what was happening with their staff. How much overtime were they incurring? Is there any patterns or trends that they should be worried about?
David Chia and his development team were given the challenge: take all that information from 3 different sources and organize it in a way that nurse leaders could use to efficiently manage their team. They created Kronos Active Alerts Enterprise. Using color coding and other visual cues, nurse leaders can now easily assess staffing for the benefit of their teams and patients. Red indicates an immediate need and prompts an email to that nurse leader. Green means there are no problems.
So our ability to gather those data elements, analyze them the same way she would if she was sitting at her desk, but let technology do that analytical work on her behalf and present her with information that says, this now empowers you to make a great decision like that. Move on, and you get to go back to caring for patients.
Far West Division CFO Steve Killian wanted to improve productivity, and Kronos has done just that.
How do we take all the data that's in these systems, put them into some kind of framework that allows the field and the directors to be efficient at what they do and be successful? This tool takes all of the data that we collect through time cards, conglomerate that all together, and lay out where we've got issues and opportunities.
Increased efficiency, patient safety, and productivity is why David Chia is this year's recipient of the HCA Innovators Award in the category of financial impact.
The hard work paid off, and the tool that they've developed and put together is going to benefit HCA for a long time to come.
Thank you for giving us a chance to show what we can do from a technology standpoint. Thank you for giving us this platform to share it with others.